Hello, my name is Race Nelson. I'll be showing you the small volume nebulizer assessment. One of the first things you want to do is check the physician's orders to see what medication will be needed, what equipment will be needed. Okay, in this case, we'll be using atropium bromide and albuterol sulfate. It's a dual neb. They come into one. Albuterol is a faster acting bronchodilator, whereas atropium bromide is a dilator, but it's more long term. It keeps airways open longer, so it's a pretty good combo. So that's the physician's order. Okay, I mean that's the medication he needs, and then the equipment I will be needing. Small volume nebulizer. It is. I'll show you. All right. So this is it. Tubing. This is the cup. You put the medication in there. Don't touch the inside, right? You want to promote infection or just bacteria buildup. Air rises, smoke builds up. Patients put their mouth on this. This is the reservoir. And if the patient is patient's good, I check the charts. It's help the patient, just a little wheezing, okay. But if the patient's worse, you wouldn't want to use this. They might have a bad inspiratory rate, so you want to use a mask. Helps them just relax while giving medication. Better, yeah. So that's beneficial. This is the equipment I'll be using. Also, I need using the pulse oximeter, resaturation of oxygen, and blood pressure cuff, a FEV, the peak flow helps read how strong the patient's expiratory rate is, and gloves and all that kind of stuff. Okay. All right, and so that's what we use. That's equipment, and now you go to the patient's chart. You'll be wanting to look at first name, last name, date of birth, male, female. There's a difference. There's comfort zones that exist in the female with RT relationship or cooperationness. You wanna check their past histories, hospitalizations, why were they hospitalized, how long they had the history of the cough, or I mean whatever bacteria that's living in there, the history of it. You know how the onset. When does it when they cough? Does it hurt? What's the characteristics? Like what activates the aggravation of this little bug or bacteria they have? Then you want to check X-rays to see in the X-rays, and also trendings. I need past documentation by the RTs. See what you get a good clear outline to see how the patient's doing. If they're getting worse, better, it's sputum collection. You want to see if anybody collected, any RTs collect the sputum, what the color it was, the color, the viscosity, the size, all that stuff, because it means something. Yellow means it's been there for a long time. Green means there's been a little bacteria buildup in there. Okay, so yeah, that's so physician. You want to check the patient's chart, IPE. You want to make sure what precautions the patient's on. Is it contact? Is it droplet or any? Is it airborne? Right. Okay, so check that stuff. You don't want to infect yourself. Okay, so now I'm going to enter the patient's room and knock and explain what I'd explained to you, but in simple words, and ensure they feel safe. Explain complications, and explain if there's any complications, what I'll do to stop treatment. Explain they acknowledge the treatment. Start vital signs. Hope I do well. Let's get started. There's a door here. I'm hoping to knock.
Come in.
Hello, my name is Race. I'm a respiratory therapist student. Can I get your first and last name, please?
Yeah, Christian Galvin, 52591.
Oh, Christian Galvin. Okay. See your first name, please. Okay, thank you. Your doctor ordered a SVN treatment. This is it's a small volume nebulizer. Have you used one before? Okay, so pretty much what it does. I'll be giving you a liquid medication. Okay, I'll be putting it inside here, and then once it's in here, it creates a gas. Okay, and pretty much that gas. It's a dual neb. It just helps you breathe much better. It's gonna open up your airways because right now you have wheezing. So this treatment is gonna help you open those airways better, so you're able to breathe much better. Okay. And some side effects you'll be experiencing is increased heart rate, tremors, and nervousness, because but that's normal. It's part of the drug. It's fine.
Okay.
I'll be monitoring it, so you're in good hands. Okay.
Okay.
Do you have any questions about anything? Okay. All right. Okay, good. That's good. I'm gonna go ahead and start with vitals, okay? I'm gonna go ahead and start that. All right. So how's your breathing?
Yeah, it's alright. Little hard to breathe right now.
Okay. Do you feel like any like mucus buildup or anything like that? Do you feel like?
Nah, I don't know about that. I just feel like I can't breathe sometimes.
Okay. Alright.
Been coughing, but no mucus.
Okay. That's fine. Hopefully after this you have wider airways, okay? Alright, I'm going to check your oxygen. Alright. I'm going to put your hand right here, okay? This right here. There we go. Okay, alright, thank you. Alright. Numbers, heart rate, heart pulse rate was at 15. 15, so I count 15 seconds, you times it by 4, which gives you 60. That's borderline, but I mean, stable looks fine, must be just a low heart rate. Could be an athlete, right? So 60. Respiratory rate was 3. So 3 is 3 times 5, well, 3 times 4, 12. Pretty calm numbers. 60, 12, that's the minimum, right? If the patient has irregular heartbeat, strong, weak, is it strong during inspiration, expiration. If it's abnormal, you want to count for the full minute. You want to make sure you just count that irregularity and get familiar and why. Everything has its own little thing. So if there's abnormal pulse rates, whatever, get to know it. Okay, does it come about when you inhale, exhale? Go, really calculate it. It's not you just want to count the full 60 minutes. It's a good thing to address. Oh, okay, Chris, I'm gonna go ahead and get your blood pressure, okay? You mind holding this up for me, please?
Sure.
Thank you. Oops, sorry. Warm up the stethoscope before you put in the patient's scan. Thank you so much. Looks pretty good. And do you mind if I call you Christian?
Never mind.
Alright, thank you. Alright. Just so you know what I saw, 120 over 75, normal. I put that in my chart. So, I mean, yeah, 120 over 75. Normal is what? Between, well, actually, yeah, 60 to 120? No. 80 to 120, sorry. 120 to 80. Systolic 120, 80 systolic. Pretty normal, healthy patient. Will be experiencing tachycardia as he takes the medication. So, alright, okay. Now back to the patient mode. I talk to the camera to tell you all the intrinsic information, but I go back into the role of the patient. So I just gave him his BP, I walked over here, now I'm going to go back to the patient. Actually, I'm going to walk over here as I put the BP down and tell him, alright Christian, good. I'm going to go ahead and hear your lung sounds to see how strong they are, okay? I'm going to do that. Okay, so just let you know, I'll be checking your chest here, these spots here, your chest, and your back as well, but also your heart. I want to hear your heart sounds, okay? And your, sure you don't want to hear that from me. Just do it, huh? Okay, do you mind if I unbutton this?
Sure.
Okay, cool. Yeah, so far you're good. I mean, you're healthy. It's just that wheezing. It's just that.
I can't breathe.
Okay, how bad is it?
It's getting worse.
Okay.
I'm
gonna be okay. All right. Well, I'm gonna be watching you. Make sure it doesn't get any bad. I'm gonna check your lung sounds. Okay, I'll be watching you. You know what? I'm gonna go ahead and put the pulse ox on. Just rest it there. Okay, hold on. I'm gonna talk to the camera, but I'm gonna talk to the camera what I think in my head. It's at 50. It was at 55, 56, 58. Now it's at 60. A little low. I mean, you already said he kind of couldn't breathe that well, but it's kind of staying at that point. That was my inside thoughts in my mind. That saturation looks pretty good though. All right. All right. Touch skin. You go to breathe. Okay. And out. Breathe in. Breathe through your mouth. Through your mouth. Okay. Okay, Christian, I'm gonna go ahead and sit you forward. Do you want me to pull the bed forward more, or you want to just grab onto
No,
here?
that's fine. I got it.
Okay.
Yeah.
All right. All right. Same thing. Go ahead and breathe in. Do you feel any dizziness right now, Christian? Okay. Let me know if you do. Just let me know. I'll stop. Okay.
Mm-hmm.
Go ahead, breathe in. One more time. You know what? I'm going to be quick. I already heard the wheezing left lower lobe. He already explained. Patient already said he's kind of felt harder breathing. Going to speed it up a little bit. Okay. Left lower lobe wheezing. All right. Good. Thank you. Okay. Do you feel do you feel you could use the flow, peak flow?
What's a peak flow?
Pretty much it just reads how strong your lungs are right now, before and after.
Okay.
Yeah. Usually, I would not. He kind of scared me a little bit. He said he couldn't breathe that good. I don't know if I would even continue doing this because I would treat it. It's kind of scared me a little bit. But for competency's sake, I'm gonna say he's gonna survive and do well. Okay? And outside, I already adjusted the parameters for Christian's body weight and all that kind of stuff. And your height again was Christian? Okay, now I'm back to. So pretty much this. So now he can perform this. Okay. So Christian, what this is, it pretty much reads how strong your lungs are right now. I'm gonna get the best, your best attempt out of 3. Okay, so just breathe in, breathe out as strong as you can, and I want to see where you're at. Okay. Then after treatment, it should be. I'm gonna do it again. It should be a little bit more. Okay, we'll make sure you get that good. I want to see where you're at. Okay. All right. Go ahead and. This is mine. He's not going to breathe it out of it. I'm going to make up a number that's related to his clinical situation. I'm going to take a breathe in and then breathe out right through there. Nice. Okay, good, good. I wish I knew what number he got, but I don't. All right, good. All right. Now try again as hard as you can. Breathe out. Go ahead and just breathe out as you can. Nice. Okay. Good, 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 good. All right, one more time. Last time, how do you feel? Wheezy? Okay, all right. Go ahead and take a breathe in, breathe out. As strong as you can. Just, okay. Nice. Okay, I see improvement. Third time a little bit stronger. I'm gonna put the numbers down. All right, 350. Okay, so to get the percentage per that treatment, it's pretty much his number. I mean, hit the chart, right? The chart we use, age and the height. With that number, so you take that number, and you divide it by his top number he blew out. Okay. I went to patient mode right now. I'm back into the camera mode. Yeah, so you take the best, so it's the best number out of 3, the best one, strongest one, 300, 350, whatever, divided by what they were supposed to get. Could be an increase, decrease, okay? And then if you feel the patient is not breathing, like if you feel his attempt wasn't as strong, like if there's a big difference between like the first breath and the third breath, first and third, second breath, have him do it again. Might want to have him rest a little bit because breathing out could really, make you feel like passing out. Okay, so make sure those 3 are really valid numbers. So people look at them and want to really know, are those true? So really do a good job at doing that. That's going off because he's below 60 sometimes. I think. I'm still in camera mode, not patient mode. So now I took the picometer meter. Now I'm going to do the SVN. Hopefully the number increases. Pulse ox on his hand because I want to see where his heart rate's at and then his saturation. Heart rate should go up. Medication, right? Increases the heart contractility. All right, Christian, I'm going to go ahead and start the treatment, okay? All right. All right. Looks good. Looks good. All right. Yeah, I heard some wheezing on your bottom left lung. So I'm gonna go ahead and hopefully it goes away. Okay. I'm here for you. That's my job. So, and I want to make sure your lungs are doing well. 6 to 8 liters. Doing 7. Okay, pick 7. No. Go to 6. Start the lowest if you could. Start the lowest. Before I give it to him, I'll explain to you what I should tell you. I don't got the medication goes in here. You open it and put it in there, okay? But you'll see gas coming out. Aerosol-wise, there's a baffle in here that breaks up the liquid, making it into a gas. And it creates a gas in the reservoir here. Don't, and tilting it by the patient, it would kind of decrease the flow of the gas, of aerosol gas, so that's kind of defeats the purpose. And also, I would want to put the medication in the device before I turn it on. I don't want to do it now and put it in there. No. Put that on, have it off, put the stuff on, put the medicine in here. Then you start it up and check it. See aerosol gas coming out. It looks better when there's real medication in here, but you'll see gas coming out. It's really good. Back in patient mode. Okay, Chris, I'm gonna go ahead and, are you left or righty?
Right now.
Okay. Well, that's fine. Okay. I'm gonna go ahead and have you put your mouth on that.
Okay.
Again, treatment is 10-15 seconds. Breathe into the patients. Patients should breathe. Patient mode. Christian, just breathe through your mouth. Don't try to breathe through your nose. Try to breathe through your mouth a lot. And also, doing a good job. Thank you. And when you can, every 5th breath, go ahead and take a deep breath and hold it for 5 seconds. If not 5 seconds, let it go. Okay. Do it for every 5 breaths. Okay. Get a good position. He does the treatment. This stuff is good because the size of the gas, it's small, so it's able to travel to the base of the lungs. Good deposition for the patient. Deep lung. Compared to like a inhaler, dry one, bigger, more upper respiratory. But this one's it's more intended for the bases. He's using the mouthpiece. It's good. Patient's healthy. I'm watching the stats. So back in patient mode. Well, I'm watching the stats as this goes on. Yeah. This is me saying time goes by. Time has gone. Treatment was, it's over now. So it's been 10, 15 minutes. It's been like 12 minutes, okay? It's baffling now, the devices, which tells you it's almost empty. Tap it, if you will. All right, Christian, thank you. All right, Christian. I'm going to tap here. All right. Good. Treatment's over. Oh. All right. Good to go. Thank you, Christian. So, thank you so much. Turn that off first. Let this bleed out. Let this bleed out. If you want to. Well, I prefer to. No gas. If you already filled the treatment, should well, there's a bag here for the patient for this here. You put it behind the bag with the patient's name. Okay, have the patient's name on there to identify if it belongs to the patient. Put it in the baggie here. This comes in the bag. Okay, so I'm gonna put this over here. Cleaning it. You want to use distilled water and let it air dry. Cleaning in the baffle. If you rub in there, it creates static. Yeah. Okay. I'm going to put this here. How do you feel, Christian?
A little better.
A little better?
Mm-hmm.
Okay, I'm gonna go ahead and do you feel you have phlegm right now? No phlegm? Okay. That tells me he could do the flow meter, peak flow meter right now. If the phlegm was built up, I would have him cough it up. I want to have him do the flow meter and have sputum. I want him, So he's airway's clear, feels good, breathing better. Stats went a little high. It went up by 9 actually. It really did. Well, actually, it was at 58. It went up by it went to 69. So that's like 12, I think. But all right. All right, good job, Christian. All right, I'm gonna go ahead and check lung sounds, okay? Let me see the wheezing out of the way. Same thing, okay? Breathe in. Breathe through your mouth for now. One more time. Okay, that's good. Now I'm gonna check the back. That's part of the reason. All right, go ahead and sit up. Feel good, huh? Mm-hmm. Good, good. Nice. Sounds good. All right. It's looking good. All right. Yeah. Sounds good. All right. Guess what? Well, your wheezing went away. So yeah, that's. I mean that's good. It worked. Okay. I'm gonna go ahead and get another set of vital signs to see where you're at. Okay. Good job. All right, put this in there. I wish I had a chart to write this down right now. I gotta turn. Anyways, just extra. I'm just talking to the camera. I'm not patient mode. I'm in camera mode. Anyways, numbers. He was at. He was at 17. 17 times 4. It's a higher number than what 60. I'll go ahead and do the multiplication. Usually I wouldn't waste the patient's time and write the times 4. I'll probably have a calculator or do it when I'm charting. 68, not much. Respiratory is a little higher though. It was at 4. So 4, 8, 12, 16. 16. A little different than 12. So medication did increase his vitals, pulse rate, and his respiratory rate. Okay. All right, Christian. I'm going to check your blood pressure, okay? Oh, okay. Yeah, thank you. Appreciate it. I'm not talking that much to the patient because I don't got much to talk. Well, he was laying down, looked tired. I just want to do my job, gentle, quiet, and just relax as much as I can. Because, yeah, I want the patient to be comfortable and just relax. I want him to relax. So, not like all talking a lot. I want to just make him relaxed. Oh. Oh, well, that's really good. All right, 120 was 120 over. It was pretty similar. 120 over 80. That's textbook. That's total baseline. All right, that's good. I mean, yeah. All right. Good. I'm going to check your forced breathing. How do you feel? You feel like you need coffee yet? All right. You sure? Okay, so make sure. All right, go ahead and same thing, Christian. Breathe out 3 times, and I'm gonna see how well the number increased. Okay, or I'm gonna see the difference. Go ahead and breathe out as hard as you can. Okay. Actually, up a little bit. All right, go ahead. Good job. And again, come on, there you go. All right. Camera time. I hope it doesn't. He's not breathing that good. The patient he didn't breathe that good. In real time, I want a better effort in real time, but this is just a competency video. But I know that would not be enough for me to put that number down. I want the patient to do it again. But that's the second time doing it, I'm going to do it again. All right. Good job. One more time. Let's go. Nice. There we go. Encourage the patient. Good, nice, good. It improved. Very good. All right. Good job, Christian. Got stuff down. Boom. Good job. All right. Okay, I'm gonna have you cough. I don't even feel like it, but go ahead and try. You're breathing better, which is good. Nice. I look at the color, any hemotesis, any color, viscosity, amount. I look at that right now. Just letting you know what I think when I see the sputum. All right, Christian. And this is a baseline. This is a baseline first time. I want to use a container thing and make sure he coughs in there. If there's a lot of saliva, the lab will bring it back. So, yeah. All right, Christian. Thank you so much. Okay. So it looks good. You're breathing better. Okay, breathing better. Everything looks good. How do you feel?
Feel alright.
Any shakiness or anything like that?
A little bit.
A little bit? Okay, cool. I mean, that's normal. Okay, well, that's it. If you need anything, do you have any questions? Or? No? Okay. If you need anything, go ahead and, I'm going to put this up here. Go ahead and, there's a call button here for the nurse. Oh.
Yeah.
That was bad, sorry. This bed threw me off. It's a fake bed. This bed is not good. I use some machines and buttons. Reverse. Well, so there's a button there called the nurse, a button here, and there's also the remote that's here. Okay, call button. So if you need anything, let me know. First, you give me a call, okay? All right, Christian, thank you so much, okay? All right. Leave the room. Before you leave the room, I'm going to show you glove. Pinch here. Boom. Here. And kind of shoot through here. Dispose. Then you would want to hand sanitize. Well, where's the trash? Here. Hand sanitize your hands. Antiseptic here. Clean your devices. Your alcohol. Have alcohol in your pocket, so you can just do it. And you don't have to go anywhere and find alcohol wipes. Get some more actually. And if you think the treatment should be continued again, you kind of leave the device in the patient's room. And the cough, when he coughed, you thought about how strong the cough was. Did it sound productive? Did the patient seem strong? Was it using? Did the patient seem able to cough strongly, which involves good coordinations. Was there any accessory muscles used? Did it sound if there's any mucus inside there still, any intrinsic things like that you want to note down. Also, his heart, S1, S2 sound normal. I chart that. At this point, I already left the patient's room. He's good. He's stable. Breathing better. It worked. The medication seemed to affect him in a good way, therapeutic way. Very good. All right. I feel good. Okay, now in response to the therapy, his it was the increased aerization throughout the lungs, which were awesome to hear. The lungs sound great. Yeah, that's post-treatment though. Pre-treatment, it had a little wheezing, but now it sounds really good. So the numbers you would want to get from the flow, the peak flow meter, the numbers FEV, actually PERF. You'll want to get the